You may have seen pictures of ER workers in their masks and gowns, along with the hashtag #GetMePPE, Get Me Personal Protective Equipment, drawing attention to the desperate need for basic equipment like masks and gowns and gloves. That campaign was started by somebody on the front lines of that effort, an ER doctor in Portland, Oregon, who saw the need, who experienced it herself, and decided, well, let's just try it. Let's just ask the world for help. Joining us now is that doctor, Esther Choo, an ER doctor and associate professor at the Health and Science University in Portland. Doctor, thank you so much for joining us. I really appreciate it.
Thanks for having me on, Rachel.
It does feel ridiculous for people with sewing machines and people with 3D printers to be activated here. It only feels slightly more ridiculous than construction companies and contractors being asked to donate their masks as well. But the campaign that you started and the way that it's resonated around the country with doctors and nurses and healthcare providers everywhere saying, yeah, the shortage is real, it's starting to seem like this stuff isn't far-fetched.
Yeah, I mean, this really feels to me like some sort of dystopian novel where regular processes have completely broken down and we're doing these really surreal things like dropping by the Home Depot on our way into a shift or asking our friends and neighbors to sew basic medical equipment for us so that we can have some semblance of being safe when we go in to take care of these patients. But that's where we are. And I'll tell you, speaking for many healthcare providers I'm talking to, I mean, this is one thing that we're fixated on because it's the first layer of protection as we just simply go in and see people and take care of them. But we're already thinking ahead to if this supply does not come through, if we're not really able to reproduce medical grade equipment through these kind of MacGyver ways, we're thinking ahead to the hard decisions we have to make. I mean, can we continue to ask this entire workforce to go into rooms where they're not adequately protected, knowing that they're going to be exposed to patients with COVID, get sick themselves, and then not be available to take care of hundreds or thousands of other patients? There are some really tough ethical decisions we're going to have to make at some point.
I mentioned earlier in the show, and I used sort of harsh language, I said that there's been quite a bit of happy talk from the White House, from the federal government, in terms of the availability of this kinds of equipment. We have seen the president and the vice president say that there's, tens of millions of masks on order and that there's going to be a plentiful supply, not only of masks and protective equipment, but also of complex equipment like ventilators. It's frustrating to me, just as an observer, to see the distance between what the White House is talking about and what providers like yourself are describing in terms of the ground reality. But I have to ask you, over these past couple of weeks, does it feel like anything's getting any better in terms of supplies of this kind of stuff?
I really want to be positive. I want to give people hope. I am listening and watching all the news that you're talking about, and I'm hearing some positive messages, and I think on the ground we would love to see those things. I will say hospital administrators, public health officials are working very hard and trying to be very creative, doing the kind of public campaigns that you're talking about. On the ground, we're not seeing we're not really seeing the delivery of items that we're hearing from our country's administration. So I haven't, unfortunately, seen it yet. We're waiting and we're optimistic. And then in the meantime, we will do what we can with what we have. And I also want to say, face masks, gowns, gloves, respirators, ventilator machines. I mean, these are the kinds of things that we've been talking about. They represent one part of many, many different types of resources that we are going to run short on. I mean, something we haven't really talked a lot about is we're right now facing a national shortage of albuterol inhalers. Those are the first line treatments for people with wheezing and shortness of breath, asthma exacerbations, the kind of things that get worse when you have a respiratory viral illness like COVID-19. So as we get over this first hurdle, if we do get over this first hurdle of things like face masks, we're going to then be talking about the vital medications that we have a shortage of. We're going to be talking about how much supply do we have of these experimental therapies that we're using to treat COVID-19, and then on to rooms and ventilators, other advanced ICU equipment, and then how we sustain the workforce of not just doctors and nurses, but respiratory therapists, pharmacists, really the complex team that you need in every hospital to take care of very, very sick patients. So this issue of we're lacking fill in the blank, it starts here with basic things like face masks and gloves. This conversation is not going to end. It'll just be the next shortage du jour for a while, I fear.
No, we need a war-sized national response to address these things each in turn, all of them. It's remarkable. Dr. Esther Chu, ER doctor, associate professor at Health and Science University in Portland, Oregon. Doctor, I'd like to ask you to come back and talk to us again in coming days as things start to evolve in Portland. We'd love to have you back with us again.
Anytime. Thank you, Rachel.